Which should you choose? Medicare Advantage, Plan G, or Plan N? We're breaking it all down and answering your questions right now.
Welcome to In Good Company, Elder Care in Your Backyard.
Today, we're diving into one of the biggest questions people have when approaching Medicare. How do Plan G and Plan N compare? And how do they stack up against Medicare Advantage plans? If you're turning 65 soon, or just getting ready to enroll in Medicare for the very first time, this episode is going to help you understand your choices and what they might mean for your wallet and your peace of mind. Let's start with the basics. When you first sign up for Medicare, you'll need to get Parts A and B through the Social Security office. You can do that online or by giving them a call. If you've already started collecting Social Security early, you might automatically get your Medicare card in the mail with both A and B included. Once you have this in place, the next big decision is this. Do you go with a Medicare Advantage plan? Or do you stay with original Medicare and add a supplement, often called Medigap, like Plan G or Plan N? Now, Medicare Advantage and Medigap plans work very differently. A Medicare Advantage plan, often called an MAPD, usually bundles your medical, prescription drug, and sometimes dental, vision, and hearing coverage all into one. These plans come with attractive extras, gym memberships, over-the-counter product allowances, and sometimes even $0 premiums. But what looks simple on the surface can be more complicated when you actually need care. For example, while the upfront cost may be low, you'll pay as you go for many services. A hospital stay under Medicare Advantage can run several hundreds of dollars a day, depending on your plan. Doctor visits might have small copays, but specialists often more, around $45 on average. MRIs or CAT scans can easily hit $500, and ambulance rides can add another couple $100. Then, there's the annual out-of-pocket maximum. Medicare sets a limit on how much Advantage plans can charge, and that cap is currently $9,250 per year. Most people won't hit that number, but many will spend several $1,000s before the year is out, especially if they face a serious illness or hospitalization. There's another point to consider with Medicare Advantage: claim denials. It's not uncommon for procedures to be delayed or denied because the plan doesn't consider them medically necessary. That can lead to frustration and appeals, even when your doctor agrees that you need the care. Now, let's talk about the other route. Staying with original Medicare and adding a supplement plan, specifically Plan G or Plan N. These two plans are by far the most popular Medigap options. They don't replace Medicare, they enhance it. You still keep your red, white, and blue Medicare card, but your supplement plan helps cover the cost that Medicare doesn't pay. Let's look at Plan G first. With Plan G, you'll typically pay a monthly premium, on average about $165 a month. You'll also pay the annual Part B deductible, which in 2026 is $288. After that deductible, almost all of your medical costs are covered for the rest of the year. That includes hospital stays, doctor visits, specialists, MRIs, CAT scans, ambulance rides, and even skilled nursing for up to 100 days. Once you've paid your deductible, you're done. No surprise bills. Now, Plan N is a little different. The premium is usually lower, around $120 per month on average. You still pay the same $288 deductible, but you might have small copays when you visit your doctor, up to $20 per visit, or $50 if you go to the emergency room and aren't admitted. There's also a small chance of an excess charge if your doctor doesn't accept Medicare's standard payment rate. But fewer than 3% of doctors in the country do that, so most people never encounter it. When you add up the math, Plan G will cost about $2,268 a year for that peace of mind, while Plan N comes in closer to $1,848 a year, even accounting for a few doctor visits and copays. Neither plan includes prescription drug coverage, so you'll need to add a standalone Part D drug plan. Those usually run between $0 and $10 a month for most people. You can easily find options at Medicare.gov. For dental, vision, and hearing, You'll likely spend around $40 to $50 per month if you want to add that coverage separately. Now, when it comes to real-life experience, here's what's important. People on Plan G and Plan N generally have very few billing surprises. Once Medicare approves a procedure, these plans follow suit and pay the rest. There's no fighting with the insurance company over what's medically necessary. That's a sharp contrast with what some people experience under Medicare Advantage. I've heard countless stories of individuals whose claims were denied or whose coverage suddenly changed mid-year because their plan adjusted benefits or networks. To summarize the difference, with Medicare Advantage, you often pay little upfront, but more as you go, and you're limited to specific networks. With Plan G and Plan N, you pay a steady premium, but can go to nearly any doctor or hospital in the country that accepts Medicare, with predictable and often minimal out-of-pocket costs. So how do you decide? It really comes down to what matters to you. If you prefer simplicity and broad access to care without worrying about copays or networks, Plan G or Plan N is often the way to go. If you're healthy, rarely see doctors, and want to save on monthly costs, knowing you might pay more if something big happens, then Medicare Advantage could make sense for a while. Just remember, switching from Medicare Advantage to a supplement later isn't always easy. After your initial enrollment window, you'll likely have to answer health questions to qualify, and not everyone is accepted. That's why it's smart to think ahead before you choose your plan. So to recap, Medicare Advantage may cost less up front, but you pay as you go and face potential denials. Plan G gives you the most complete coverage with one small deductible. Plan N offers a slightly lower premium, but adds small copays and the rare possibility of an excess charge. Either way, understanding these differences now can help you make an informed choice, one that fits both your budget and your health needs. And that's our breakdown of Medicare Advantage, Plan G, and Plan N. If you're approaching 65 or helping a family member through the process, take your time, compare your options, and make sure you know how each plan actually works before signing up. Thank you so much for listening. Like and subscribe and give us a 5-star review on your favorite platform. Stay with us as we unpack what's new in healthcare right here in your backyard. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.